Thank you. Good afternoon, everyone. It's really fantastic to have won this category with so many fantastic submissions as well. And of course, we absolutely love data in our patient experience team, but we love our patients even more. So being able to demonstrate and win an award for how we've used data to improve people's experiences is really meaningful to us. Ooh, there we go. So, when our two organisations joined in 2022, we inherited very different approaches to patient feedback. Data sat centrally with us and the patient experience team. It was very hard to theme, and it was slow to reach the people who could really make a difference and make those changes. So we saw this as an opportunity to transform how we engage with our patient voices. On the slide, you can see wonderful Linda, our administrator, surrounded by a mountain of data, largely FFT cards, you might recognise that, which was really challenging to interpret and act upon. So as feedback, we had FFT, we also had a basic subscription to Care Opinion, and if you don't know what Care Opinion is, it's a digital platform by which people can leave us their feedback, and many organisations may have the basic subscription to that. So, we asked ourselves, how can we capture the richness of real stories, but also structure the data so it drives improvement? And that's when we decided to move to a level 3 Care Opinion subscription and trial a new model where services owned their own feedback directly instead of everything sitting with us centrally. Leadership backed us from day one, which gave the idea momentum and credibility. This was the starting point of a journey from passive data collection to active real-time engagement, turning patient stories into a powerful evidence base for change.
So I'm going to go back to the beginning of our journey, back to 2020. So our first steps were to pilot the subscription, and we did that with our cancer services team. And we asked them to respond directly to patient stories instead of the central patient experience team. As you can imagine, initially there was some staff anxiety about receiving negative feedback and responding in a public domain. However, they soon became confident in responding, and the team began seeking feedback from service users. On the screen, you'll see is the first story where they made a service improvement based on patient feedback. And their success showed frontline ownership was feasible and beneficial. And that proof of concept created organic interest from other departments. So rolling this model out across a trust of our size couldn't just be an email, it had to be movement. So we created a phased rollout plan with built-in coaching. We had interactive training and informal drop-in sessions so that staff felt supported at every step. Working hand in hand with our communications team, we developed a plan, and to show how important this was, our CEO recorded a video message inviting both staff and patients to get involved. This combination of practical training, visible leadership, and smart communication turned Care Opinion from a pilot into everyday practice across the whole trust. So we also aimed to maximise on the inclusivity of the platform to make sure that all voices were being heard. So we've got British Sign Language videos for the deaf, we've got QR codes, we've got free phone numbers, along with being able to engage with many languages via the portal. So where are we now? And the numbers have changed a little bit since I put the slides together. We now have got over 700 staff trained as responded, and they're dotted within our services. We've received over 8,000 stories, and of those stories, 97% have received a personal response from the service. More importantly, there's been a cultural shift to services owning their own feedback, and that includes making service improvements and de-escalating potential complaints and PALS cases. And now I'm going to get to the heart of it, the innovation, and why we've won this award. And when I looked at the PENA Awards criteria, one of the elements mentioned was, your idea is going to be an idea so simple you'll think, why haven't we done this before? And this is exactly what this is. And what we do is we simply tag every Care Opinion story to enhance our reporting. This includes tagging stories with the KO41 national complaints coding. We tag with divisional codes and other codes that are really relevant to our data reporting. It only takes a few minutes each morning, but what this does is it enables us to align with PALs and complaints reporting. We can drill down into large services and feed directly into divisional reporting and governance. It really is a simple idea with such a powerful impact. And the numbers tell the story. We've had a 327% increase in feedback. We've got a 97% personal response rate. Again, the numbers have changed since I put the presentation together, but we've currently got 110 service improvements that have been implemented with a further 68 in the pipeline. These are monitored by our governance channels. An unintended consequence has been that we have had a 20% reduction in formal complaints during 24-25. And whilst we cannot directly attribute this reduction to the care opinion platform, there is compelling evidence that staff are actively de-escalating issues that might otherwise be referred to PALs or result in a formal complaint. This is our data driving action. So here you can see our new monthly care group performance reports. These include responsiveness, criticality, themes within the feedback, and changes implemented within the data, so our teams can see the impact they're creating and keep improving.
So what have we learnt on our journey? Well, our first lesson is the power of a unified vision. Early on, the patient experience team agreed clear goals and a shared message. This meant that all the data we collected from KO41 codes to care opinion stories was used consistently and credibly, giving staff confidence in the numbers and enabling us to show clear improvements. Secondly, we started small and scaled up. We piloted in a single motivated service before rolling out trust-wide. The result was a smooth transition and clean, comparable data sets instead of messy one-off experiments. Thirdly, we got visible support from senior leaders. Having our CEO and non-exec directors championing the data approach gave it strategic weight. It meant care opinion data was just not another report, but part of board discussions and divisional dashboards. Fourthly, keep investing in people. As Lisa said, over 700 staff have been trained to respond to patient stories with tailored coaching on using data to improve care. This has created a sustainable culture of frontline ownership and better use of real-time transformation. And finally, integrate our data. By aligning real-time patient stories with national complaint coding, we've built a hybrid data set that's richer, more credible, and easier to triangulate with PALs and formal complaints. This makes reporting meaningful and actionable, driving measurable improvements such as the 271% rise in feedback and a 97% response rate. Thank you.
Well done, ladies, well done. And indeed, any questions? Aha, excellent. Love a question person.
Thank you. Great presentation. We're from Plymouth, so just down the road from you. We're desperate to have care opinion, and I understand Scotland procured care opinion as their national patient feedback platform, and I just wondered from your perspective, sort of what are the barriers to us adopting a similar system within England or indeed sort of at ICB level?
Money. It'll be really interesting to see what comes out of the NHS England procurement of a feedback platform. I really hope that that platform is used in a meaningful and qualitative way rather than a punitive numbers and collection of data way. So it'll be interesting to see what's coming over the hill. We feel very lucky that we are still continuing to fund this service because it's had such a really fantastic feedback response from both patients and staff.
Any more questions? Yes? Down the front.
Thank you for your presentation. I understand well that it's nationwide for the whole of England. for the whole.
For the whole of England.
So care opinion, every trust has care opinion, but if you don't have an advanced subscription, you have 2 responders within your trust, so that they're given as a freebie as such. The trouble with that is, if you get negative feedback, you normally say, please go to PALS. If you have positive feedback, you say, thank you very much, I'll share it with the service. But that's increasingly frustrating for the patient because they've already written down their story once, so they don't want to have to retell it to PALS. So the advanced subscription is the best way forward.
Okay, thank you.
Any more questions? No. Thank you very much, ladies.